Welcome to Better Than Ever Live, wherever you're watching or wherever you're listening. Hope you make today your masterpiece. Today we're going to talk about fecal transplants. Yes, that's right. It sounds gross, but it actually might be a way to slow or reverse aging. We're going to talk about glucosamine, possibly lowering your risk of death. We're going to talk about why ibuprofen, along with blood pressure medications, might actually harm your kidneys, how antioxidants can lower your risk of dementia, exactly why the longevity diet might be so effective at increasing your lifespan and health span, and why you should only eat during the day. I'm Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Please understand, as always, I am not giving you medical advice in this show. This is meant for general information and educational purposes only. Whether you're watching on YouTube, LinkedIn, Facebook, I'd love to hear your comments or any questions you have about some of the studies we talk about. Leave those in the chat. I'd love it if you give your first name and where you're located along with your comment or question, and I'll try to answer those as we go. But let's start with one that you probably aren't really that familiar with and sounds disgusting. But we're going to talk about fecal transplants. And there's a study showing that they may actually reverse or reduce aging of the GI system, eyes, and brain. The study was published in Microbiome, and it was a mouse study. And what they basically wanted to see is if you put the gut bacteria of a younger mouse into an older mouse, what effects that would have, and does it affect aging of various body parts. Now, we've talked about the GI tract and the microbiome before. They've got billions and billions of microorganisms that have a huge effect, not on just our digestion, but all different aspects of our health. Immune system and immune function, metabolism, mood and psychiatric disorders. Serotonin comes largely from our gut. Protects us against infection, mental health, so many different things that our gut bacteria are important for. And when we have a change in our gut bacteria, it can lead to a lot of health problems, whether that's taking a broad spectrum antibiotic, that's eating a lot of bad food. Things that affect our gut microbiome can cause a lot of problems, infections, inflammation, that kind of thing. And when you get really bad bacteria in your gut or depletion of your bacteria in your gut, like after antibiotics, one way to fix that is fecal transplantation. It's basically where a doctor inserts feces from a donor with healthy gut bacteria, gut flora, into the colon of the person with the bad gut microbiome. So here again, this is a mouse study. They had 3 different age groups of mice. There were mice that were 3 months old that were considered young, 18 months old considered old, and 24 months old about to die or aged. And what they found, so what they did, they depleted the gut of the bacteria, the microbiome, of all the mice receiving the fecal transfers. They gave them broad spectrum antibiotics to wipe out the bacteria in the gut. Then they gave the younger mice fecal transplants from the older mice, and they gave older mice transplants from younger mice. Now, what do you think might have happened? Well, they compared the groups with each other and groups that either got no fecal transplant or got one from mice their own age. The younger mice who received fecal transplants from the older mice, the aged mice, had increased inflammation in the CNS, their brain and spinal cord, and in their eyes. They also had leaky gut, increased intestinal permeability. Now, when they gave the older mice fecal transplants from the younger mice, they saw the exact opposite of that. The GI system, the eyes, and the brains got younger with transplanting feces from younger mice to old. So the question is, well, 1, is this going to apply to humans? We don't know that. And then 2, is this a permanent effect? Is this a temporary effect? We don't know that as well. But that could be a crucial factor, especially if aging, and there's a lot of thought that aging is probably the key component. Inflammation is the key component of aging. If we can have treatments that reverse that process, fix that process, we could know a whole lot more about how to keep various parts of our body, organ systems young, vibrant, healthy, all of that. So it may not be something you're super interested in, but that is something that is on the horizon. All right, let's talk about glucosamine. A lot of people know what glucosamine is. It's very common in the orthopedic world as a treatment for osteoarthritis. This is a new study, though, that shows another benefit for glucosamine. It was published in the Journal of the American Board of Family Medicine. Now, the reason glucosamine is used as a supplement for arthritis is this natural compound that's found in cartilage. And so people with joint pain, people with arthritis, try it as a potential source of relief. I have been underwhelmed with glucosamine as an arthritis treatment, but I tell you, I have a lot of patients that swear by it and say it really helps. So I have nothing against it. There's really no downsides. It's hard. The studies have not been terribly convincing for glucosamine as an osteoarthritis treatment. But this study was done out of West Virginia University. They took almost 17,000 people that were at least 40 years old. They took them from the National Health and Nutrition Exam Surveys, this huge database of hundreds and hundreds of thousands of people that collect data on what they eat, supplements, medicines, and then follow them over a long period of time to see how any of that correlates to diseases, illnesses, that kind of thing. Now, even when they accounted for other factors in these 17,000 people, age, sex, smoking, exercise, all of that, what they found is that the people who took glucosamine chondroitin supplements on a daily basis for at least a year had a 39% lower incidence of all-cause mortality, almost 40% drop just by taking glucosamine. Looking specifically at the heart, cardiovascular-related deaths, daily glucosamine was linked to a 65% death reduction. I mean, that death risk reduction. Huge drops. Now, this is one of those database epidemiology studies, so this is not a clinical trial. They didn't give one group glucosamine and one group, a placebo and then saw what happened. So there's no cause and effect necessarily here. It's not to say that glucosamine causes you to have a lower risk of death, but it seems to be associated with it. I'm not even sure I can come up with a good solution. One of the issues, we just talked about inflammation and aging. One of the thoughts with cardiovascular disease is that inflammation plays one of the key roles. Maybe glucosamine is having an anti-inflammatory effect on the heart and the vascular system, the endothelial cells and things like that. And that's why maybe there's a lower risk of death. That's one that we're going to need more trials on, but it's really interesting. All right, I was just having this conversation with somebody earlier today, and I want to talk about this because I think it's important, and that's the idea of taking ibuprofen, the anti-inflammatory over-the-counter medication. It could damage your kidneys, especially if you take it with high blood pressure medicine. This study was done using computer-simulated drug trials, found that people that are on certain blood pressure medications and then you add ibuprofen may put you at risk for kidney damage. This was done at the University of Waterloo in Canada, and they looked at two specific types of blood pressure medicines, diuretics and renin-angiotensin inhibitors, very common types of blood pressure medicines. A lot of times patients with high blood pressure are on both of those. And then the question is, all right, what is the risk of kidney damage with those two? And then what's the risk if you add ibuprofen to those two? This was published in the journal Mathematical Biosciences. And the combination of taking all three of those drugs significantly increased the risk of acute kidney injury. 31% increase in acute kidney damage compared to patients with only the two blood pressure drugs. So if you're on blood pressure medications, talk to your doctor about whether ibuprofen, naproxen, those non-steroidal anti-inflammatories is safe for your arthritis, but maybe you consider taking acetaminophen as well. I was just talking to somebody earlier today about all the different issues that I have with, and not that I have, that science has with anti-inflammatory medications. We were talking about endurance runners that take ibuprofen before they go out on a run to prevent muscle pain, muscle soreness after. And I read a study, 70% I think was the number I saw of long distance endurance runners take ibuprofen before runs. But the problem is when that is not necessarily a benign thing. We've got the kidney issues here. We know it's associated with heartburn and GI ulcers potentially, but they have a significantly negative effect on your gut microbiome, leading to inflammation in the leaky gut, like we talked about earlier, can cause things like mood changes and mental health issues, depression, anxiety, messes up your sleep, and and it's more than that. But on top of that, doesn't seem to be that good at healing muscle damage. It may make you feel a little bit better, but it's actually not fixing the problem. There are studies in animals, at least, that show that non-steroidals actually slow healing of muscle injuries. So really not the best strategy. I am not a huge fan of ibuprofen, naproxen type medicines, other than just as a one-time thing here and there. But as a regular medication, I think they've got probably more downsides than they have upsides, quite honestly. I don't know. It's just my little rant there. All right, let's talk about antioxidants and a lower risk of dementia. A new study shows that people that have higher levels of certain antioxidants in their blood may be less likely to develop cognitive decline and dementia as they get older. This was published in the journal Neurology. The researchers took data from 7,200 participants, again from that National Health and Nutrition Exam Survey. All the people, the 7,200, were between the ages of 45 and 90 at their first visit, and they were followed for 16 to 17 years, some as much as 26 years. None of them had dementia at the first visit. They looked to see how many people then over those 16 to 17 years were diagnosed with Alzheimer's and other types of dementia over that period of time. Now, what they found as far as antioxidants go, people 65 and older that at baseline had the highest blood levels of lutein and zeaxanthin had a lower risk of developing any type of dementia during the follow-up period compared to people with low levels of those antioxidants. Another antioxidant, beta-cryptoxanthin, compared to people who had low levels of that, they had a lower risk of any type of dementia throughout the follow-up, 45 to 60-year-olds and those 65 and older. Now, you don't need to know the names of those specific antioxidants. They're what's called carotenoids. They are what give fruits and vegetables their yellow, orange, and red color. So very, very important. Lutein and zeaxanthin you can find in dark green vegetables, kale, spinach, broccoli. Beta-cryptoxanthin you can find in fruits, oranges, papayas, peaches, and tangerines. I read a book a couple of years ago written by Daniel Amen and his wife, and it was, I want to say it was like The Brain Warrior Way or something like that. And part of it was about diet. And I remember, and it's really good advice and one that I should be much better about taking. I love certain green vegetables, but I don't eat a lot of reds and yellows and oranges, carrots, squash, red peppers, that kind of thing. But and to be honest, I don't eat that much in the way of fruits other than red grapes periodically. But that kind of fulfilling the rainbow of fruits and vegetables is probably best in terms of nutrients, vitamins, minerals, these flavonoids and carotenoids that can be very, very helpful. These flavonoids and carotenoids are free radical scavengers and antioxidants, very, very helpful for a number of different health conditions and preventing those, and potentially helpful to prevent dementia. All right, I want to talk a little bit about the longevity diet. We talked about this a couple weeks ago, and I want to get a little bit more into it about what it is and why it potentially might help you live longer and feel better. Again, if you missed that show a couple weeks ago, we talked about what the longevity diet is. It is a legume-rich diet, a whole grain-rich diet, pescatarian or vegetarian largely. 30% of the calories come from nuts and olive oil, lots of monounsaturated fatty acids. Low amounts of protein until you're 65, and then moderate protein intake, which is good for bone density and some other things as you get older, but low protein intake before that. Very low sugar, very low refined carbs, no red meat, no processed meat, very small amounts of white meat. And then those are what to eat, what not to eat. Then you eat all your food in a 12-hour window and you fast for 12 hours every day. Time restricted feeding, just not as strict as what a lot of people do. And 3 times a year, 3 cycles of 5 days of a fasting mimicking diet. And I'm going to talk about some of the different parts of this, but I just read Tony Robbins' book, and the nutritionist that talks about the longevity diet in his book, his fasting mimicking diet, unless I misunderstood something, was 1,100 calories a day for 5 days. That is, for a lot of people, more than half of their calories that they get on a normal day. Most of the time when I see fasting mimicking diets, people talk about 400 to 500 calories a day or less. But those fasting cycles, very, very important. All right, so let's look at the parts of this and why it might be important. One, fairly high levels of unrefined carbs, not processed carbs that are in boxes, bags, frozen food containers, things like that, but unrefined carbs, foods you actually have to cook. Low plant-based protein intake, regular fish consumption if you're going to have fish, were all linked in a study that looked at why the longevity diet was so good. All three of those were thought to be things that on their own extended your life and improved your health span, made you feel better while you were doing it. Plus, the longevity diet doesn't track a certain number of calories. It basically talks, you want to keep your body mass index under 25. You want to keep your ideal body fat and lean body mass, muscle mass levels compared to gender and age levels for what matches you. Now, where this can be really interesting is that a lot of people in today's age of people being overweight and obese, high levels of insulin resistance these days, you think, all right, well, why would eating all of these carbs, that could potentially be bad for me? But what they found out is that the good thing about complex carbs, not processed carbs, is yes, they're good as you get older, they reduce frailty, but they provide energy without increasing insulin and activating those glucose signaling pathways. So you minimize the risk of diabetes and insulin resistance while still providing carbs. So that's one of those things, complex carbs that are not easily broken down into sugar, much better at reversing insulin resistance. Plus, speaking of insulin resistance, that periodic fasting, those cycles, 3 to 4 days, or 3 to 5 days of fasting mimicking diet reverses insulin resistance that's caused by our normal everyday diet, lowers blood pressure, lowers total cholesterol, lowers inflammation, which is probably a big part of why these improve lifespan and health span. Plus, you do this typically, that is going to lead to calorie restriction and protein restriction, which have been shown in multiple studies to be good for longevity. Also, one of the things about a low protein diet and getting most of your protein, if you're going to get it from legumes and plant-based proteins, is that by eating less meat, especially less red meat, you're reducing the intake of an amino acid called methionine, which has been linked to pro-aging cellular pathways. So yes, protein is important for you, but maybe getting it more from plants might be the way to go. Plus, plant-based diets over and over again have been shown to reduce your risk of type 2 diabetes, cardiovascular disease, and lower inflammation, again, in multiple studies. This is not a one-size-fits-all, but there's a lot of play with this, but it's generally low protein, no red meat, really very little meat, more plant-based proteins, lots of complex carbs, lots of olive oil and monounsaturated fats, and then again, the eating within a 12-hour window every day, and 3 times a year, 5 days of a fasting mimicking diet appears to be extremely good for your health and longevity. And then the last thing I want to talk about today is this idea of time-restricted feeding, but limiting it not to late afternoon and evening meals, but maybe only eating during the daytime, and it actually could help you live longer. This was a study that was published in the journal Science, and what they found is that if you ate mostly during the day instead of at night, it could help you live longer. Researchers from the University of Texas Southwestern Medical Center said, hey, it doesn't matter what you consume, but when is what's important. They say that cutting down on fatty and sugary foods, having your meals at the right time, increase the longevity 35%. But this was a study in mice. And what they did is they gave the mice pretty much all of their food at night, which is when they're active, and it increased their longevity 35%. So the equivalent of that, these researchers say, would be that we should eat most of our calories, actually not most, all of our calories when we're active during the day. This would be, so most people that do time-restricted feeding do it by skipping breakfast, eat lunch and dinner. This would suggest it's better for you to eat breakfast and lunch and skip dinner, which is hard from a social standpoint, but it makes sense because you still have a chance to burn off those calories. I saw a speech of a nutritionist maybe 2 months ago, and she said, hey, you should eat less often. Calorie restriction and eating within a narrow window of time to give your body time to fast. But she did say that ideally you'd want to eat all your food by 2 o'clock. Now that may be a little much, maybe you eat by 5 o'clock, but eat while the sun is still up. It is probably much, much better in terms of longevity, but probably your health as well if you can eat breakfast and lunch instead of lunch and dinner. Having said that, again, one of the challenges with that is that's hard to do socially. You're out with your friends, your family, they're all wanting to eat dinner. It's hard not to. All right, let me know what you think about any of that. I will take comments for a few minutes and then we'll wrap up. If you want to see me as a patient, if you have an orthopedic problem, and I know we're not talking about orthopedic injuries and stuff here, I do that on my show on Friday at 12 p.m. Eastern Time, Ask Dr. Geier, but I've gotten a number of people that reach out to me, especially wanting to ask about some of the not surgery, not cortisone treatments for bone, tendon, ligament, joint, muscle injuries. I'd love to see as a patient. I'm a double board certified orthopedic surgeon and sports medicine specialist, and focus a lot on anti-aging and regenerative medicine. I'm happy to see you in our Charleston, South Carolina office. There's a link to my website, drdavidgeier.com, and that will take you to my website. You can click on the Work With Me button. There's a contact page, fill it out, and we can talk about ways to get you down here to Charleston to see me as a patient and learn about all the options that might be right for you. Now, if you like videos like this, you want more information about optimal health, wellness, healing, recovering from injuries, exercise, nutrition, sleep, all of that kind of good stuff, aging, longevity, all that kind of stuff, or you know somebody that does and they want to feel and perform their best, you want to feel and perform your best, make sure you subscribe to this channel. Click the bell if you're on YouTube. Click the bell to be notified whenever I release a new video or I start a live stream. And remember, Fridays are only on YouTube, but definitely check that out. Make sure to subscribe to the podcast, Better Than Ever Live, wherever you get your podcasts, and make sure to check out the Better Than Ever Daily podcast, a very short, less than a minute long health tip every Monday, Tuesday, Wednesday, Thursday, Friday. You can get Better Than Ever Daily wherever you get your podcast. Very, very excited that you were here with me today. If you can't tell, I'm a little under the weather today. Don't have my usual energy, but I hope this was helpful. I hope you took some action steps, whether it's fecal transplants or the longevity diet or whatever it is. Let me know how it goes if you have thoughts about any of that. I will see you Thursday, 5 p.m. Eastern Time for our next Better Than Ever Live. And remember, if you have orthopedic injuries, I will be here Friday, 12 p.m. Eastern Time for Ask Dr. Geier Live. Have a fantastic night, and I will see you soon.